Hi guys, this work is being presented to you by Odai, Sarah, Emily, Abigale, and Kodjo. Our country is China. A liberal history. China had been under imperial power until 1912, when the Republic of China was established. From Xia Qin to Qin dynasties, the country had gone through several fallouts and reunifications. During this time, China had no defined healthcare system. Health services were mainly provided by individual healers and traditional medicine practitioners. Royal and military members are the ones that get quality health care. The Republic of China was established in 1912, but civil unrest dominated the system until the establishment of the People's Republic of China. Amidst the Civil War came World War II in Imperial Japan. At the end of the war, China lost over 20 million civilians and counted several hundred thousand tortured. The war has ruined the country economically, politically, and financially. In 1949, the establishment of the People's Republic of China put an end to the Civil War and reunited the country. However, the new system had led to 15 to 35 million deaths from starvation between 1958 and 1961. The Cultural Revolution caused about 2 million more. Despite the multitude of failures of the political system, China was able to convert many privately owned hospitals into public ones, and by the end of the 60s, China had the largest healthcare workforce in the world. Soon this led to failure because of waste of resources until private sectors emerged again in 1978.
Here are the demographics for China. You can see that there's a fairly large population size with multiple nationalities. Han Chinese stands at 91.6% right now, as well as religions such as Buddhist, Christian, Muslim. The population pyramid shows China's population over numerous years. The large bulge in the 25 to 34 age range represents the high birth rates over 25 years prior to 1975, and then under age 25, the numbers are sharply reduced, which might be an effect of the one child policy. Other factors that are responsible for the reduction in fertility include urbanization, education, and healthcare, which both promote and result from economic development. Here are some of the critical measures of China. You can see that the life expectancy at birth for the total population is about 76 years, with women being almost 4 years greater than men due to high strenuous work in the factories and activities like that. And from this graph, you can see that both the birth rate and the death rate kind of increased around the Great Leap Forward and then declined greatly after China's one child policy went into effect in 1979.
Political system in China is communism. As the constitution states, the People's Republic of China is a socialist state under People's Democratic Dictatorship. The general structure of the government is composed of the president, followed by premier, four vice premier, and many other administrative divisions. The political instability started with the fall of Qin dynasty and the establishment of the Republic of China in 1912. The Civil War continued until World War II and the establishment of the People's Republic of China in 1949. And this is followed by a Cultural Revolution under Mao, when they lost over 2 million people. Health policy and one child policy. In the early years of communism, many privately owned hospitals were converted into public ones to take care of the people. Today's areas of focus are medical security via insurance, public health services through government funding, primary care in urban and rural areas, and pharmaceuticals. In 1979, China enacted the one-child policy, which restricted the number of children families can have to one. This policy lasted 37 years.
We're going to talk about the cultural aspects of the one child policy. We saw that rural populations were often allowed to bypass the policy as a result of needing extra labor. We also saw a decreased fertility rate, but this could also be a sign of the country's development and the advancement of educational and work opportunities, especially for women. Another interesting event that occurred during this time period was the Chinese stock market crash, which could be directly related to decreased population growth and which increased the per person burden of the Chinese economy. And that could be one reason that we now see that two children are allowed in order to sustain economic growth. Aging can also be largely related to the one child policy. In China, we see that populations are aging way faster than most countries, which could also be directly linked to the development of the country as we see increased life expectancy and decreased birth rates. These rates also coincide with developments in access to care that were implemented by the Chinese government, which this is a natural consequence of educational and economic development. Um, because of this aging population, there's more burden on the workers to support their dependents, which could cause some strain in society. But we see that this isn't a huge issue in China because of their collectivist culture. So their collectivist culture is supported by their religion, which is typically Taoism, Buddhism, and Confucianism. And their collectivist culture, with some tendencies to shift towards individualism recently, but basically their culture promotes selflessness. It centers around society and doing what's best for society as a whole. And this increasing rate of individualism can be related to the new work and educational opportunities for women and men, which is also directly linked to the fertility rate decreasing because of pursuing careers. China also has a society that is typically noted as missing girls because sons are more valued than daughters. In our cultural assessment lesson, we learned that it's really important to look at how a community looks at health and illness and wellness. And so Chinese culture typically evaluates health as a balance between body, mind, and spirit. And so when you have an imbalance in those three, you have a physical illness. And if you disrupted emotional harmony, that leads to mental illness. Many believe in working towards health through proper diet, which uses herbs and foods to treat illness before we use Western medicine. And their treatment is overall very holistic and looks at the social determinants more so than we're used to because they look at the relationship between the body, environment, social factors, and geographical factors. So, two of the biggest health disparities we saw were the rural urban disparity and the educational disparity. So, for rural urban, it's very similar to America's, where access to care is most affected by geographic features. And an interesting fact is that rural insured patients have less access to hospitals than urban insured patients. For education, we saw an intergenerational link where a parent's level of education is positively related to health and hospital access for the rest of their family and their children. And the illiteracy rate is higher for rural citizens and higher for women, but it has declined over time.
Okay, so although the government of China has adopted the UN Declaration of Rights of Indigenous Peoples, it does not actually recognize the term indigenous peoples. So they actually have 55 ethnic minorities recognized by the Chinese government, in addition to the Han Chinese majority. And the current population of ethnic minorities stands at 111,964,901, which is just 8.4% of the country's total population. And some challenges that the indigenous people face include the strict controls that the government has to try and prevent indigenous people from practicing their cultural and religious traditions, as well as the ownership of land and the forced relocation of inhabitants, which continues to be a challenge for many indigenous people, specifically in the region of Inner Mongolia. The first determinant of health is finance, and this includes village level as well as county hospitals. So local health authorities set fee schedules and doctor salaries, and the county hospitals are perceived to be the providers of the highest standard of care at the highest price, with village level clinics being available to individuals who don't make as much money. The central government is responsible for providing the necessary equipment and machine for the hospitals, and the SIN is the local or county government, and this deals with drug production and health salaries. In terms of culture, there are 3 different types of doctors that are specific to the Chinese community. These are barefoot doctors, which is a local villager with not a lot of medical experience, the Red Guard doctor that works in cities, and the worker doctor that works in factories. These are going to be crucial components in a health system with shortages in trained medical personnel. And there's also a great general acceptance for these professionals because they are native locals and they provide cultural links between the peasants in China as well as the Western style medicine that is essential for healthcare.
Currently, healthcare in China consists of both private and public healthcare insurance options. While the country believes everyone deserves the right to be healthy, and public health is the key to China's success as a country, the public insurance option only covers about half the medical costs with little to no coverage for serious and chronic illnesses. To provide a basic understanding of China's healthcare system, one option for public health insurance can be classified as workers' insurance. This is when the employer provides medical insurance for the employee, and this is done with minimal government funding. It is mandatory that employees in urban areas opt into this insurance type. The other option is residence insurance. This is for the unemployed or those on social assistance. This insurance is financed mostly by the central government with minimal individual premium contributions. Less developed areas are provided with more money from central government, and those in places with more development, subsidized or locally provided by the provisional government. 95% of the population uses one of these two options. Additionally, you can purchase private health insurance, which is provided by for-profit commercial insurance companies. This is usually for higher income individuals who receive a higher quality of care with higher reimbursements, and this is because some health services are expensive or not covered by public insurance. In China, you can use your insurance policy out of network, but it will usually result in higher copays. China also has established a sort of safety net when it comes to covering the costs of people who can't afford premiums for public health insurance or cannot pay out-of-pocket cost. These payments are covered by a medical financial assistance program, meaning they are covered by the local government and social donations. So what's covered on the public insurance? Publicly financed insurance covers premium care, some specialty services, emergency department, hospital, some mental health care, as well as some prescription drugs and traditional medicine. Additionally, there are some dental services, not including cleaning, and some optometry services that are covered, but they're usually paid for out of pocket. Home care and hospice are often not included. Since there is no coverage for long-term care, it is almost entirely paid for out of pocket, and it is usually provided by family members at the home of the sick. This can be tied with the Chinese tradition of respecting and taking care of the elders. Few resources or facilities are available for long-term care, and ones that are have long wait lists. Preventative services such as immunizations and disease control are funded by the central and local government, and every resident is entitled to these services with no copay or deductibles.
Now that there is a better understanding of the healthcare system in China, let's look at some recent strides China has made in relation to Millennium Development Goals. In the final report of the MDGs released in 2015, the progress that China had made in 15 years was substantial. The highlights include lifting millions of people out of poverty, reducing the under 5 mortality rate and maternal mortality ratio, and increasing the percentage of the population using an improved water source and sanitation facility. However, China was unable to meet many of the environmental sustainability benchmarks. For example, carbon dioxide emissions grew significantly, from 3 to 10.3 billions of metric tons, when the goal was to reduce them by 50%. Now looking at the progress on the SDGs, due to the scope of the 17 SDGs, there is a focus on the two that are directly related to health, Goal 3 and Goal 6. There are many benchmarks set forth in each of these goals. However, the markers represented here attempt to reflect the critical measures of China's health status as a whole. China continues to reduce maternal, child, and neonatal mortality. Note specifically that the maternal mortality ratio is indicated to be 27 in 2015 by the SDGs, but was reported to be 33 in 2015 by the MDGs. The UN does not provide disease-specific benchmarks, but relative to its neighboring countries, China tends to do comparably on reducing the incidence of each disease. Additionally, the UN does not have some data because progress is self-reported, which means countries choose what to report and that the UN has minimal control over the accuracy of reporting. China has taken additional measures outside of the SDGs to improve the health of its urban populations with initiatives called Healthy China 2020 and Healthy China 2030. These programs aim to reduce chronic diseases and obesity by changing lifestyle choices. As mentioned earlier, countries self-report SDG progress to the UN. For Goal 6, there is not much data on the water quality in China or availability of clean drinking water to the population. In general, the benchmarks set under Goal 6 are either not met or not reported for China. Now looking at the economic status of China. A comparison to the US is provided to put China's economic numbers into context of a more familiar economy. The GDP of the two nations are similar and the GDP per capita is reasonable based on the two countries' populations, but health expenditure is drastically different. However, it is known that the U.S. spends a disproportionate amount on healthcare. Therefore, a regional look on health expenditure needed to be taken. India spends $267 per capita on health, and Myanmar spends $103 per capita on health. So regionally, China is spending more on healthcare. There are 4 major industries that influence China's GDP, but near 50% come from manufacturing. Manufacturing has significant health implications on the people in China. There are poor working conditions that lead to potential health issues, but the main effect on health is due to the weak environmental standards in China that leads to both air and water pollution. In fact, life expectancies vary within the country based on pollution levels. Thank you for listening, and we hope you learn more about China.